Okay, so today I will be showing you how I would find a pulse and take someone's blood pressure. However, I don't have anyone here to assess. I only have a pillow, so a lot of it will be me talking you through the steps of what I would do to find someone's pulse and take their blood pressure. Hi, my name is Juliana, and today I will be your student nurse. I was asked to come in here to take your blood pressure and find your pulse. That's just to make sure that your blood pressure is not too high, not too low, make sure everything in your heart is healthy and tip-top. Is that okay with you? Okay, great. So I'm just going to start by finding some of your pulses. So the first one is your apical pulse. So that's by your heart. So I'm just going to use my stethoscope and listen to that, if that's okay. Okay, great. So in this stance, I would go under the resident's shirt with their consent, and I would listen for the apical pulse. Okay, great. Thank you. Okay, so since my resident was a pillow and doesn't have any limbs for me to find pulses on, I will show you on myself where I would typically find those pulses, and I will talk you through how I would normally take a blood pressure. So I was able to show the apical pulse on the pillow, and if I was looking for the brachial pulse, I would go on the inside of my elbow here, and I would use my 2 fingers. If I was looking for the carotid pulse, I would go on my neck. If I was looking for the femoral pulse, I would typically go around here, more on the inside of the leg. And if I was looking for the posterior tibial and the dorsalis pedis, I would go on my ankle and the top of my foot. Okay, so for taking a blood pressure, I would find the pulse, the brachial pulse, and I would assess if they were a child, a small adult, or a large adult, and I would then pick the appropriate sized cuff to use, and I would take this index line here, line it up with the location of the pulse, and wrap the cuff around snugly on their bicep so it doesn't slip or slide, as this could cause an inaccurate reading. From there, once the cuff is secured, I would find the pulse again. I would use my gauge and I pump in my gauge, and I would pump air into the cuff until I couldn't feel a pulse anymore. And then I would slowly let the air out and wait 30 seconds so I can do the second step of a 2-step pulse. So for the second step, I would use my stethoscope, and I would place the stethoscope bell on the pulse, and I would pump it up 30 more mmHg than my last measurement, and I would listen. I would slowly let the air out and listen for the first sound I hear and the last sound I hear. So this would be the systolic and the diastolic pressure, which those 2 numbers would help me determine a healthy blood pressure, which is typically 120/80. So from there, when I'm assessing the blood pressure, I would be assessing the quality and the rhythm of the pulse, whether it was a strong pulse, a weak pulse, whether it was a regular or an irregular pulse, and I would also ask the patient if they were taking any medications for their heart rate or blood pressure.